Mark Merrill. He's the president and chief executive officer of Valley Health System. Mark has decades of experience in healthcare administration, and since 2009 has been with Valley Health, which is 6 hospitals covering the Shenandoah Valley and parts of West Virginia. Valley Health has more than 5,300 employees and a medical staff of over 500 people. This is big time. Mark, welcome to the show. Great to have you, man.
Thank you, John. Good morning to you.
Now, listeners of my show know that I've been putting a lot of focus on the challenges confronting local hospitals across Virginia. Because here's what happened, Mark. Everybody got caught up in the Medicaid expansion debate. I'm not in favor of it because I'm not in favor of expanding Obamacare. But here's the bottom line. We have to do something. We can't stick our heads in the sand because this issue, Mark, is not going to go away, especially in rural communities. Now, Valley Health has hospitals in Page, Warren, Shenandoah counties, and Winchester. You know, these are areas that, you know, don't have the kind of high volume you're going to get in South Side or Richmond or Northern Virginia. They're more rural areas. Can you tell us, Mark, about some of the things from your perspective that you're seeing as a leader of a health system of rural providers?
Absolutely, and I first want to thank you for bringing attention to this very important topic for our Commonwealth. Rural health care in Virginia is under stress. As you may know, there are roughly 37 rural hospitals in Virginia, and half of them right now are operating at an operating deficit. Rural areas in Virginia, they're beautiful parts of the countryside, part of the prettiest states in the United States, but the demographics and the economics of rural Virginia are materially different than other parts of the state. Per capita income is lower. The percentage of families with an income below $25,000, which is the federal poverty limit, is higher. The number of people over age 65 is higher, and we also have a higher percentage of people who have not graduated from high school. Additionally, the economics in many of the rural areas are not driven by large businesses, but many of them are tourism, seasonal worker. In our particular area, we have a lot of tourism and agriculture business. We also have some robust other businesses, but we're particularly challenged with having this type of economic engines that some of the other parts of the state have. So the challenges that we face are, number one, access. You know, are there a sufficient number of physicians and providers in the communities? The population that we serve, as I mentioned, is slightly older and a little less economically challenged. Workforce issues are ones that we deal with in terms of recruiting and attracting professionals into these areas. So there are also, last but not least, we have found that there are more patients with multiple chronic conditions than in other parts of the state. So we have some real challenges ahead of us.
I've been doing almost a weekly segment on this. Every candidate that I've had on, whether they're running for the House of Delegates, Republican, Democrat, State Senate, whatever, everybody's focused on who's going to win control of the State Senate. At the end of the day, I don't care who wins. You've got to fix this problem. Now, it's helpful when you connect the dots in a way so that people get a sense of how things function in these hospitals, because it's complex, and if you're not in these rural areas, you're really not affected by it, right? I live in Great Bridge in Chesapeake, which is I live 5 minutes from Chesapeake Regional Hospital. I don't have the problems that you're going to have in some of the areas where your hospitals are. So people need to understand that the government has a long and heavy hand in our healthcare system. And ignoring that or saying that that's how it's always been isn't the answer. We definitely have a problem. I've been ringing the alarm bell for weeks, and we're in need of a policy solution. And simply saying I'm opposed to Medicaid expansion or I'm for Medicaid expansion and going on with that ridiculous argument right now is not solving the issue. Am I right?
You are correct. If you look at what's happening in the healthcare communities, hospitals are very large economic engines in the communities that we serve, and in particular in Virginia, in 82% of the areas where in what's defined as rural Virginia. 82% of those areas, hospitals are among the top 5 employers. And in our particular case, in Valley Health, we have 6 hospitals, 4 in Virginia and 2 in West Virginia. In each of the counties and cities where we have a hospital, we are by far the largest employer. So it's an issue of economics in terms of economic stability as well as access to health care. Of interest, and I came from an urban area before I moved to Virginia, but in our community here, it's very noticeable how dependent other industries are on our healthcare system. In our area, restaurants, real estate agents, hotels, they are very excited and desirous of trying to earn our business. When we went through a recent implementation of a new electronic health record, and the hotel owners and operators here were very excited. We had consultants and experts coming in, and they were very desirous to work with us because they needed that injection of activity into their businesses.
Now,
so it's critical that these hospitals maintain not just because of the access and services they provide, but also the economic vitality that they bring to these communities.
Well, the bottom line is some of these hospitals don't have the financial means in order to offer the services that people need. Let me give you an example. Trauma. If you live, Mark, in certain parts of Virginia and you have a head trauma, it might take you 3 hours to get to a trauma center. Now, you're in the hospital business, you're a senior healthcare executive. The difference between 20 minutes and 3 hours for head trauma, well, life and death, right? So
Absolutely
this is
right.
just reality, right?
Yes. In fact, in our area, we have a level 2 trauma center at Winchester Medical Center, and I was proud of our board of directors and trustees for endorsing that. But we're the only trauma center in a 400-mile service area.
Think about that. Think about that. 400 miles.
It's not just, and we're right there on the Interstate 81 corridor, which, as you know, has become increasingly busy, and the accidents on 81 continue to increase. So it is a lifesaver for these patients to be able to get to our trauma center. Without that, it would be helicopter rides into either Charlottesville, Richmond, or Washington, D.C. You can see how far away those facilities are. So it's an investment that we make because we are there to serve the community, but it's an investment that's subsidized. And as cuts have continued to occur with both Medicare and then the sequestration cuts that have came on top of that, it's particularly challenging for hospitals. You address the issues of coverage expansion.
Right.
Again, we're desirous of finding a solution, a nonpartisan solution, because right now we hospitals continue to take payment cuts because of the Patient Protection and Affordable Care Act, sequestration, and other regulatory changes, but we've had no relief yet from the uncompensated care burden that continues to grow in states that have not expanded coverage.
So if you're running a hospital, Mark, and it's continually losing money, or certain services that you're providing are just bleeding red ink, what happens?
Well, we have maintained a focus on trying to make sure that we consolidate services where we can. For instance, we had an obstetrical service at one of our hospitals that was no longer viable, so we consolidated with another hospital. So we consolidated the OB service there. We've consolidated our behavioral health service at one of our hospitals. So we attempted to do that, but over time, the challenges become increasingly difficult. It's like the dance floor continues to get smaller, and you have to tap dance a little bit faster and more diligently.
Is working to communicate with the public and policymakers about the critical economic importance of hospitals. To do that, the association recently launched a new public awareness ad campaign highlighting the value and benefits provided by local hospitals and health systems and the challenges that they face every day. We advertise it on our stations in Virginia. What can you tell our audience about this effort, and how do you think it can make a difference?
Well, thank you. Yes, the Virginia Hospital and Healthcare Association launched a campaign called Virginia Hospitals Our Lifeline. And it's a simple message that hospitals and health systems are very important. The healthcare systems of Virginia employ roughly 115,000 to 120,000 people, which is roughly 1 out of every 9 jobs in Virginia. There's roughly $8 billion of payroll and another $17 billion on goods and services that we provide. So our focus is to raise the awareness of the challenges that the hospitals and health systems are facing and engage in a conversation about how can we help these hospitals continue to be the economic drivers that they are. We're very proud of what our hospitals provide. We provide substantial amounts of charity care. In 2010, there were over $600 million of charity care provided. They're very gracious with regard to uninsured or people with low insurance being able to serve these regardless of the payer mix. In other businesses, if you're hungry, you just can't go into a restaurant. If you're homeless, you just can't go into a hotel. But if you're sick or injured, you will be taken into a hospital and cared for just like everyone else. So there's a tremendous responsibilities that our hospitals feel to make sure that we continue to serve the Commonwealth. The recent Ebola crisis was another example of that. If you think about how that was very scary for our nation and obviously remains a threat, so hospitals are prepared for that. And again, whether or not that threat comes is we hope it doesn't, but in the event it does, you want to make sure that your hospital is there and prepared to care for those patients who have that and protect other citizens from exposure like that. So we've been a supporter of trying to support hospitals, obviously, and so that people in the communities know that they have a reliable source of health care.
Now, Mark, so we don't run out of time, how can people learn more about the Virginia Hospitals Our Lifeline campaign?
That's great. I would ask you to encourage people to go to isupportvirginiahospitals.com for more information. The website has a lot of information, bullet points about the challenges facing hospitals and also what hospitals do. We're trying to raise awareness of this as we approach the 2016 General Assembly when healthcare legislation will be discussed. And that's why we're having this conversation now, so it does become a crisis situation, but we've engaged in conversation now and start looking at alternatives before we come to a resolution of this burgeoning crisis.
I told you before, every candidate that I get on my show running for office in the State House in this upcoming election in the General Assembly, I ask every single one of them, what's your plan to solve this problem? It's interesting. I get some people that have no idea what I'm talking about, and they immediately say, I'm either for or opposed to Medicaid expansion. We have got to get out of this argument because it's driving me bananas.
Yes.
Virginia is not going to expand Medicaid right now, okay? It is not going to happen. So there's got to be an alternative to that, and we have to solve this. Hospitals are critical. And look, I call my show Common Sense for the Commonwealth. Mark, this is just common sense. Now, it's reassuring to know, like me, that your local hospital is going to be there if you ever have an unexpected emergency. My mom, Dolly, just had a series of problems. We're 10 minutes from the hospital. We go in. It's always there. It's 10 minutes away. But if I was 2 hours away, or if they didn't have the services that I would need, I don't know what I would do. And people that live by a hospital with all the services take this for granted. We elect our leaders to find consensus and solve problems. The issues facing hospitals and the financial squeeze that is their reality today are real problems, and they have serious consequences for Virginia. Now, I'm going off on a little bit on a tangent, so bear with me because I feel passionate about this. We've already lost one hospital in Southwest Virginia. There's others that have scaled their services way back, like delivering babies and other things in more rural areas.
And also behavioral health.
Behavior, exactly. Look, all you have to do is go back to what happened in the Cray-Deeds family, right? Everybody remembers that, where they couldn't get his son a bed. I mean, these problems are real. Other hospitals, they've scaled back services that impacts the access to public health. It also affects jobs,
yes,
and the economy. And look, I'm no fan of Obamacare. I think it's a disaster, okay? And I'm not in favor of expanding Medicaid either. But this is an issue that has got to transcend politics, and that's why I've been asking so many of these candidates about the issue. They all acknowledge the problem, but I got to tell you, 13 days to November 3, I'm yet to get a straight answer from any of them. So I really encourage our legislators on both sides of the aisle to figure this out. Am I making any sense at all, Mark? Mark?
Yes.
Okay.
You faded out. I apologize. I lost you.
Thank you. As long as you think I'm making sense, I appreciate that. Hey, Mark, thanks for being with us.
You are making sense, and I appreciate you bringing awareness to it. As you said, we have to find common sense solutions, and the legislature doesn't want to talk about the word Medicaid expansion, but they have to recognize that hospitals are taking year-over-year payment cuts to where by 2020 it will be roughly $600 million as part of the Patient Protection Affordable Care Act.
Right.
And those cuts are continuing, and if they are not offset by some other relief, then it really will jeopardize the status of hospitals.
All right, I got to take off. I want to thank